Marie had just turned 6, and she had been coming home from kindergarten every day telling me how thirsty she was. I took her to the pediatrician. I was sent right over to the Park Nicollet clinic immediately to start her on insulin. I had a few tears on that trip. It was really hard to have that diagnosis. It was a huge learning curve, huge change to just our family routines. We started checking Marie in the middle of the night then and finding that her blood sugar was going really high also. Half of her life was spent sleeping, and we didn't want to leave half of her blood sugar numbers unmanaged and then deal with, the possible long-term complications of diabetes. And so that would involve a shot. And she, as a 6-year-old, did not want shots in the middle of the night. And so that was why we made the switch to a pump. And we were just really excited that that technology was out. My husband could prick her finger and give her insulin, and she would never wake up.
I have had diabetes since I was 6 years old. I was the same age as Marie when I was diagnosed. The first thing that I tell them is that their child will be okay, but I also tell them that they should cry, because it's sad. So the basis of managing diabetes successfully is diabetes education. And that's the team approach to the education with the nurse educators, the dietitians, the physicians. It really is a whole team effort that involves the family team as well. The support that our team gives patients in clinics and their families is really across all areas. Grandparents, babysitters, daycare providers, school nurses. Depending on the age of diagnosis, families and their children will go through a lot of different transitions. Who's doing the button pushing? That's different for a 6-year-old than a 16-year-old. And so it's our job to get those changes in place at the right time so that they can be successful.
When Marie was first diagnosed, my biggest fear for Marie was that diabetes would hold her back from being a confident kid and a confident adult. It was important for Julie and I to have Marie involved with the latest technologies. We would always hope that there would be a game-changing technology before Marie would graduate from school. Right now I'm most proud of Marie for the simple fact that she smiles and that she loves life. I'm proud of the fact that she can go to camp with her friends and that she loves to go there because she has the confidence to just take care of her diabetes on her own. The fear that I have right now would be that there'd be a low situation that would show up that would be a total surprise.
The IDC was fortunate to be one of the centers to do the first artificial pancreas study ever done focused on getting a system approved for actual clinical use. Marie was one of those pioneers that volunteered to step up and help us understand just how well this artificial pancreas system would work. If the artificial pancreas system we've worked on continues to work the way we've seen so far, our hope is that we really will reduce the complications of diabetes, reduce the burden of living with diabetes, and help people pursue their dreams with just a little more peace of mind. To learn this new artificial pancreas system, both patients and clinicians are going to have to learn some new skills that they haven't used before to really improve the lives of people with diabetes.
This study and the closed loop system that I've been participating in has really dramatically changed my life. Like just having that freedom to be able to handle it yourself and just feel like a normal person. And if for some reason something goes wrong, my pump will alert me. So I think I've had a lot of renewed confidence with this closed loop system in that I can have the independence of a typical high schooler at the high school. I think it's been super helpful in allowing me to have the confidence that when I do go off to college that I won't have many problems.
There is a lot of funding for the actual research and development of this technology, but there isn't a lot being done right now around actually how you bring this into clinical practice and what it means really in a person's life. Philanthropy can really fill in the gap. Philanthropy has the power to accelerate getting this technology into the hands of patients. This technology will bring better control to people, and so they're going to have better health outcomes and less complications. I mean, it's going to totally transform their health and well-being. Just thousands of people.